What are some common mystery illnesses, or what are some common illnesses or chronic disease that no one really realized could benefit from a five pillars root cause approach, or that's going to be later diagnosed as being autoimmune? So, this is going to be important. Listen up, people, because some of this is going to shock you, and none of this your doctors know. And this is from my years of experience. And so I'm just going to tell you the way I figured this out, honestly, was, when I had a private practice in Oregon, I gathered a lot of I had literally thousands of autoimmune patients in the state of Oregon was in my clinic, my integrated functional medicine clinic. And at the time, and what happened was a lot of these autoimmune people were getting better and better, but they would like bring me their kids. So guess what happened? I amassed one of the largest spectrum disorder clinics with kids with spectrum, there's autism spectrum, ADHD, behavioral issues, eczema, irritable bowel syndrome. I inherited a lot of those from my autoimmune adults. And that's when it dawned on me. I was like, these kids are actually showing, these illnesses are actually early signs of autoimmunity. And there is no blood test to diagnose them as autoimmune. But why do they keep happening with autoimmune parents? Right. And I have a child with those. I have two children, and one of my children had spectrum disorder, also diagnosed with possible ADD. One of my children had severe eczema allergy issues. That was horrific. So I saw those patterns in my own children. But to this day, if you actually ask a regular doctor out there, if any of this is autoimmune, they're going to be like, oh, no, it's not. And I'm going to call bullshit on that but it's not out of bad intent. The reason really is that they don't have enough of a population and experience with autoimmunity like I do to be able to say this definitively, that based on my experience, symptoms of autism spectrum, ADD, IBS, severe eczema, allergy, multi-allergy symptoms in children absolutely is part of this autoimmune spectrum that we're talking about. And I am positive that we're talking about in a couple years to come, we're going to see that, oh my gosh, there are autoimmune diseases all along. Okay. So I'm going to tell you that some of these mystery illnesses aren't so mystery. They actually are just part of autoimmune spectrum. And I'm going to name PANDAS. PANDAS is another illness that can affect kids. That's really part of an autoimmune spectrum. I'm going to talk chronic fatigue syndrome is typically, it's not chronic fatigue. It's basically fatigue caused by many different autoimmune diseases is labeled as chronic fatigue syndrome. IBS, irritable bowel syndrome. Most of those people, most of them are dealing with some sort of autoimmune issue going on anyway. Neuropathy. If you have this mystery neuropathy where you have numbness and tingling or weakness and nobody can diagnose what it is, how likely do you think that's autoimmune? Like 100% people. And even if it isn't, the real answer is, can it benefit from a five pillars root cause approach to it? And the answer is hell yes, because do you know 30% of people who come into our program don't have a diagnosis? Okay. And if 30% of the people coming into our program, Transform Autoimmune, don't have a diagnosis, but yet every single week I have an interview of an alumni who's getting dramatic improvements and 30% don't even have a diagnosis, this works for any mystery illness because I know it, because 30% of our graduates don't even have a diagnosis, and it works.